And welcome to today's Speaker Spotlight. It's a great privilege and an honour to get to talk to Jane Townson today, who's the Chief Executive of the UK Homecare Association, and she's a confirmed speaker at our conference, New Normal to New Future, coming out of COVID. Thank you very much for joining us today, Jane.
It's a great pleasure. Thank you, Glenn.
Okay, thank you. So first question, Jane. You have made an enormous impact on the UK HCA, and I think it absolutely now is a major force in the social care sector. What do you think has been the greatest challenge for the sector with the COVID pandemic, and how has the sector met those challenges?
The social care sector and the home care sector within it faces many challenges, and they're interrelated. And we came into the pandemic in a weakened position with a workforce with high levels of turnover, maybe 40% in some areas, even 50% I've heard recently, and financial sustainability being not strong enough. And we've been really grateful to the government for supporting us with emergency funding through COVID-19, which has largely kept everybody afloat. But it feels very much like a sticking plaster over a broken leg. And we really haven't managed to adequately address some of the underlying issues, particularly workforce and financial sustainability.
Okay, thanks for that. You talk an awful lot to providers, and I think that that's been the hallmark of your leadership as I've looked into the UK HCA in terms of your closeness to the front line, understanding those issues that providers are facing, and then being a loud voice with your team to government. Can you give us an example perhaps where you've seen some significant innovation in the sector, perhaps as a result of COVID?
Gosh, there are many different examples, and maybe I can just very quickly outline 3 different types actually. So, some of them don't necessarily have to be that earth-shattering. Innovation doesn't always involve artificial intelligence or anything like that. But, for example, quite a number of people benefit from going to day centres normally, and in the pandemic they haven't been able to because of the restrictions on social connection and so on. And so some providers have been offering those kind of services virtually, and I've seen examples of care workers who would normally be running a day centre actually physically going and visiting people in their own home to make sure that they've got meaningful activities, that they're not lonely, that they're living as well as they can and as safely as they can. So that was really good. We've seen quite a number of examples of technology solutions being employed. So from Internet of Things type sensors to be able to monitor deviations from normal for a particular individual, so that normally people can be fairly independent without too much intervention. But if anything goes wrong, people can spot immediately and offer assistance. And then third area is maybe more advanced approaches to remote monitoring of health and using care workers to track health outcomes. So for one example is one provider that uses digital solutions for running their business noticed that they were experiencing a higher than average number of falls that were linked to urinary tract infections. And they realized that it was quite difficult sometimes to get GPs to take action quickly. So what they did was train their care workers to use dip tests, to take temperatures, to record behaviors or symptoms that seemed out of the ordinary. And the idea was never to try to get the care workers to diagnose a person, but really just to collate information, so that when they made a phone call to the GP, instead of saying, you know, Betty's a bit off colour today, they could say, I've done a urine dip test, I've taken Betty's temperature and it's this, and these are the symptoms that I've seen. And that then gives the GPs information and confidence to be able to take action to treat people faster. And the outcome of that has been a 63% reduction in emergency admissions to hospital. So, and the same provider was also using technology platforms to monitor respiratory health during COVID. Quite a number of CCGs, for example, clinical commissioning groups, have given pulse oximeters to people, and home care workers have been involved in helping people to use those. So all kinds of things have been going on in a positive way.
Yeah, I think they're three really, really good examples. And I guess that particularly that latter example around the delegated healthcare task, as we go from new normal to new future, that's something that we, I guess you would want to see increase, better for the customer, better for the care worker who's getting job satisfaction out of that, and very much better for the NHS, saving resources.
Yes, provided there is the investment and the training and support for care workers. We did hear a really good example recently in one part of the country where a federation of GPs have purchased a home care business, and they have realised that home care workers are going to see their patients every day. And so the GPs have started talking regularly to the home care workers so they can get feedback about their patients. But that has the added benefit that then the home care workers don't feel so professionally isolated. Yeah. So they've got people that they can go to if something out of the ordinary or complex, or that they don't feel equipped to deal with themselves. They've got routes to go and ask. So we'd really like to see some more of that kind of collaboration on the ground.
Yeah, I really, really like that. Very good example. I'm sure the Secretary of State of Health and ministers will be very interested in the conference. If they were in the audience, what would you want them to take away and action? What's the number one issue? You've talked about reform of social care, but what do you really want them to do?
Well, our vision is for a society where all of us can live well at home and flourish in our communities. The National Audit Office recently published a report about the adult social care market, highlighting again the demographics and how numbers of people over 85, numbers of older and disabled people in general are going to more or less double in 30 years' time. And the number of people that will need 24/7 care is going to increase as well. And doing nothing, kicking social care into the long grass continually, is not an option. We already have a good piece of legislation in the form of the Care Act 2014. And there's another piece of legislation, Health and Care Bill, which is beginning its passage through Parliament. What we really need is Her Majesty's government to create the conditions to enable those two pieces of legislation to be effectively implemented, which the Care Act has never properly been. So, for example, by adequate investment, by the right kind of policies, by regulation maybe, and by maybe additional legislation, but nothing major that takes years. We want to see investment to address unmet need, to enable the costs of care to be adequately covered, and to ensure fair recognition and reward of the workforce. And we do need fairness and clarity on the contract between state and citizen, because we understand it's unlikely that government is ever going to be able to pay for everybody's care needs forever. So what do we have to plan for as individuals, and how could we do that? How could government put things in place like they have done with pensions, let's say, to help us? What could there be any tax policy changes to make it easier for people to purchase their own care, for example? And to make it easier for people to find their own care. I mean, sometimes we come across people who've got plenty of money, but they can't actually find anyone to look after them. Or I heard an example last weekend of the mother of a friend of mine who was discharged from hospital on a Saturday afternoon with no home care. And how do you find someone yourself on a Saturday afternoon if you're poorly, you know? So things like that we need to fix. And we also want to see a focus on outcomes. As you know, Glenn, you know, there's been a trend towards purchasing home care by the minute. Well, if you're going to take that approach, how can you ever begin to think about the aspirations of the Health and Care Bill, which talk about enhancing healthy lifespan, reducing inequalities, more preventative approaches, you know, looking at the social determinants of health rather than just healthcare itself. And that will involve the citizen being at the heart, the person, you know, or the individual being at the heart, and taking a more active role in directing their care and support, and having more choice and control, as the Care Act talks about, and then being able to join up those services. So I talked about multidisciplinary working on the ground. That is how in practice it happens. But then being able to you know, collect data in the first place, and then to share that in a safe and GDPR compliant way between key partners and families as well. So, you know, we'd like to see practices like purchasing home care by the minute to be outlawed, and to focus instead on improving those health and well-being outcomes.
Yeah, a really good and comprehensive sort of shopping list there, Jane. So thank you. Without outcome-based care, outcome-based commission, it's almost self-evident that that must be the right thing to do. What do you think are the blocks there? Is it simply money? Is it cultural? What are your views?
If we look at why councils have gone to per minute purchasing of home care, for example, it's mainly because their budgets have been severely constrained, and the number of people that they need to support has increased. So they're trying their best to ration the care within the resources that they've got. But it kind of creates perverse incentives, and it doesn't really, I mean, in a hospital, nobody would measure a nurse or a doctor by how many minutes they spent by a bedside, would they? It's did you get the patient well or not? And it just seems strange that we don't have that way of thinking in our sector. So lack of investment is definitely one barrier. But I do think as well, the way that a lot of things can be solved if you've got good relationships and collaboration on the ground. Some people talk about, you know, the structure of the system and the fact that, you know, social care is delivered through independent providers, but there are lots of other parts of the health system that are delivered by independent providers. So, for example, community pharmacists, dentists, opticians, GPs, they're all independent businesses. They're not you know, employees of the NHS, but they are able to be integrated into the health system. Everybody knows what professional standards they have to meet. There are contracts, there are agreed prices for these different things, and there are methods of communication. So why can that same way of thinking not apply also to social care? And some areas have got primary care networks that seem to be working quite well. And it's been interesting for us to watch the rollout of the vaccination programme, because the areas of the country that have the best working across the system seem to have managed to roll out the vaccination programme fastest and most effectively. And I don't think that's a coincidence. It's because people know each other, they trust each other, they work together normally, and they get better outcomes for people, in this case, faster vaccination, which made for more safety.
Yeah, I think the key word for me there is trust, and getting a little bit more trust into the social care system. So thank you for that. This conference is probably one of the highest profile conferences that, you know, I have seen. I think it's absolutely fabulous that Sir Simon Stevens is addressing a predominantly social care audience. What do you hope the conference will achieve?
Well, obviously a platform, and a high profile platform to stimulate thinking, to share ideas, to make connections, to give social care a voice, and to see key people like Sir Simon Stevens articulating, maybe from an NHS perspective, but you know, it doesn't really matter, you know, the importance of social care.
Yeah.
And it would, you know, it'd be great to see the voice of people with lived experience as well. I'm not sure if that's happening, but you know, for people receiving services, you know, what have they got to say as well?
Yeah, absolutely, absolutely. So social care clearly has survived the pandemic, or we've certainly up to the point that we are in the pandemic, and has been an absolute key service in making sure that the NHS hasn't toppled over with the incredible demands that are on it. Looking forward over the next 12 to 18 months, from a provider perspective, what would be your sort of top 3 tips to providers as to how they should behave going forward?
Well, to home care providers in particular, the pandemic has probably raised public awareness of social care more generally. Much publicity has been about care homes, not always for positive reasons, but that has actually led to a benefit for home care, because people are thinking, you know, are there other ways? Do I have to go into a care home at this point? So awareness of home care has improved, and we would encourage providers to do all you can to raise awareness locally of your services, and that would be you know, talking about really positive stories, trying to get things into the local paper, making connections with GPs and, you know, local groups like the WI or the Rotary Club or whatever, you know, just so that people who need support know where to find it when they need it. Second tip would be make sure that you charge a fair price for your services so that you can invest adequately in your workforce, because that's really the key to quality and sustainability. If you can manage to hang on to your people, train them well, everything else becomes so much easier. And kind of related to that, don't bid for contracts which are financially unsustainable or which appear operationally undeliverable or difficult to deliver, because you as a provider will bear the liability and the risk for failure. And finally, I'd say invest in technology solutions to improve efficiency and quality where you can, because it's an absolute game changer to be able to see in real time the records of the people that you're supporting, where your care workers are, getting metrics really quickly and easily. And then even better if you can connect together your care delivery system with your roster system, your payroll, your system for invoicing, and make the whole way of doing business as efficient as possible, which many other sectors have been doing for years, but we're rather behind the pace in the care sector. And so I think before we start doing fancy pants stuff, we need to get some of the basics right, and use technology in fairly standard ways, but which can make a huge difference.
Some very wise top tips there, Jane. Thank you for that. And I guess on the technology point, you know, as partnership with the NHS and others deepens, that technology will help that partnership in terms of the exchange of data.
Yeah.
Thanks for that. I guess another top tip would be join the UK HCA if you're a domiciliary care provider.
100%. And, you know, we have seen an increase in our membership quite substantially over the last year, 18 months, which is really encouraging. And it's a really good forum for sharing ideas, for getting mutual support, for having your voice heard so that we can articulate providers' wants and needs to central government, local government, the regulators, the media, our other partners in the care sector and in the NHS. So yeah, come and join us. And you know, we are more powerful if we stand together. The more of us that speak with one voice, the harder it is to ignore.
Okay, thanks for that, Jane. So my final question is, for me, the unsung heroes of the pandemic have been our frontline care workforce, either in care homes or working in the community. how do you think we should say thank you to our workforce and celebrate their hard work?
Well, it is hard to find adequate words to express our debt of gratitude to them, isn't it? Because when many other professionals were remote working, they were actually physically going and visiting people in their own homes or working in care homes to make sure that people were safe and well. And they did that so selflessly and with such compassion and care, even though they themselves were quite anxious and afraid, particularly at the beginning. But ultimately, all the clapping and saying thank you in the world doesn't really mean anything unless we follow up with really ensuring that their care workers are adequately trained and supported, and that plays to the point I made earlier about that feeling of professional safety. I'm not talking about being abused or anything. I'm talking about having backup and people that you can ask if you encounter situations which are difficult, and clinicians that you can go to and so on, and obviously fairly recognizing and rewarding the skill and competence and experience that you need to perform these roles. So we need to see a workforce strategy to go alongside a 10-year plan for social care that addresses some of these issues that we have.
Okay, thank you very much for that, Jane. Thank you very much for your insights and for your time. And it's given us a little bit of a sneak preview as to what we could expect at this really significant conference. If you want to know more about the Care Talk Live conference, preparing for a new normal in social care, tickets are on sale now. And please visit the website www.caretalk.co.uk/conf to find out more and book your slot. Thank you very much.